Welcome back, everybody. This is video 11, the anatomy of a long bone. Don't forget there is a quiz over this video. So as soon as you're done with this video, I would encourage you to go right on over, go take that quiz. Make sure you are taking these videos and these quizzes seriously because it's very easy to predict what kind of grade you're going to get based on the grades that you're getting on these videos. So make sure you're taking these seriously. Today we're going to look at the anatomy of a long bone. The reason we do that is they are the biggest bones that you have in your body, things like the femur and the humerus, the tibia. So it makes it really, really easy to visualize the parts that you have inside the bone. So what I'm going to use for reference here, I will have some pictures on the slideshow as well, is a femur. And in particular, this is a left femur. I'm not sure if my camera is flipping it around how you view things or not, but I can tell that this is a left femur based on the direction that the head of this femur is pointing, while I have the knee joint facing the correct direction. So when you look at this femur, there's a couple of different structures that we look at here, areas that we might note on this. First, you have the ends of the bone here. The ends of the bone we're going to call epiphyses. You're going to have the proximal epiphysis. Remember, proximal means closer to the point of attachment. And then the distal epiphysis, remember distal meaning farther from the point of attachment. So obviously when you're considering your leg, the hip is literally the point of attachment. The knee is going to be more distal. So we'd have our proximal epiphysis here. Really, it's going to be anything that is not the tube-like structure and shaft in the middle. So everything here, proximal, is going to be our proximal epiphysis. And then when I flip this around, this is going to be the top half of your knee joint here. Everything from here, distal, is going to be your distal epiphysis. In the middle of this tube here, we're going to have the diaphysis running along the middle here. Most of your long bones are going to have some sort of tube that runs along in the middle here, so you can separate kind of where this distal epiphysis is, this diaphysis, and then the proximal epiphysis. Your long bones are going to be composed of both spongy and compact bone. Spongy, you can think of it as kind of looking like a sponge, where there's a whole bunch of holes and a network of spaces within that bone. Usually, that network of spaces isn't going to be hollow, however. It's going to be filled with red marrow. And we'll talk about what red marrow does here in a second. But that spongy bone is really good at allowing some bend in the bone. So if your bones get really brittle, they don't like to bend. It's actually a disease called osteoporosis is when that happens. Your bones become brittle and they like to break really easily. So you need a little bit of bend in your bone. You don't want them to be completely solid. Compact bone is what's going to be providing some dense, rigid structure that's not going to have that network of spaces. That's why we call it compact bone. And you can kind of see here the difference between the two. Spongy bone is going to have all of these this network of spaces. This is going to be filled with red marrow generally. Compact bone, there's not going to be any space, so you can kind of see here. This is, I believe, a picture of one of your skull bones here. Kind of looks just like a spongy bone sandwich, where you have compact bone on the most superficial layer as well as the deepest layer, with spongy bone or cancellous bone through the middle here. So generally with your long bones and with any bone, you're going to have compact on the outside as well as the most inside, the deepest, with spongy bone sitting somewhere in between in general. That's not always the rule. And I just realized that my picture was in the way there, so I'll get my picture out of the way. Hopefully you can see that network of spaces for spongy bone when compared to compact bone here. Sorry about that. Okay, so taking a look inside your diaphysis, remember that is the tube-like shaft in the middle of a long bone here. If we were to open up this diaphysis, and I can't do this on this bone here, so we'll just have to rely on pictures, you're going to get actually a cavity within that diaphysis. We call it the medullary cavity. But as usual, it's not actually truly hollow. It's actually going to house yellow marrow, which is really, really good fat storage. And it's a way that your bones can take extra fat and it can store it in those long bones for later use if they would ever need to. And actually, the reason dogs love to gnaw on bones is because of that yellow marrow. They're trying to get to the middle of that long bone so that they can get some of that nutrient-dense yellow marrow, that nutrient-dense fat that sits in that medullary cavity. The walls of the long bone and the walls of the diaphysis are going to be made of compact bone. We already kind of talked about what that compact bone looks like. The inside of the diaphysis, so you think this is going to be the lining of the medullary cavity, really, is going to be lined with what's called endosteum. This is where a lot of bone growth and repair is going to take place. So there's two primary cells responsible for repairing and growing bone. We'll take a look at those at a later date. But the outside of your diaphysis is going to be lined with periosteum. And this periosteum is going to be kind of like this connective tissue sheath around the bone. It's going to be where a lot of blood vessels and nerves are going to be running through before they penetrate into the bone to deliver nutrients to all of your bone cells. I'll get my picture out of the way here so you can kind of see we're dealing with the diaphysis here. So you can see compact bone running along the length of the diaphysis in the middle here. Medullary cavity in the middle is actually truly filled with yellow marrow. They just emptied it out for you so that you can see the endosteum on the inside there. And then this tiny little connective tissue, and they peeled it back right here, is the periosteum. When we take a look at your epiphyses, these are going to be, remember, the ends of your long bone. One of them is going to be proximal, and one of them is going to be distal. The diaphysis, that shaft, is going to meet an epiphysis at what's called an epiphyseal plate. And that's just the fancy term for your growth plate. At that growth plate, wherever it meets, is actually a line of cartilaginous cells. Basically, I think they're hyaline cartilage. They might be fibrocartilage. But cartilage turns into bone really, really easily, or your body can turn cartilage cells into bone cells fairly easily. So you have that cartilage that runs along there where the diaphysis meets the epiphysis, and that epiphyseal plate, your growth plate, is constantly turning those cartilage cells into bone cells and then pushing them out, either towards the diaphysis or towards the epiphysis. And what happens is that's actually what causes your bones to get longer. Just that constant formation of bone cells and then pushing the ends of the long bone away from one another so that you can maintain that epiphyseal plate. Eventually, when you are done growing, that epiphyseal plate kind of falls apart. All those cartilaginous cells are no longer cartilage. They're going to actually turn into just normal bone cells. And at that point, they form an epiphyseal line. So it's an epiphyseal plate while you are still growing, and an epiphyseal line when you are done growing. The outside of your epiphyses, so you think the ends of your long bones, are going to be covered with articular cartilage. Most of your long bones are going to be used for some sort of movement, so it's important to have that articular cartilage to be able to reduce friction, reduce stress, reduce impact on those joints and on those bones. And the way articular cartilage, articular just means to touch or to move against. So, like I said, they are a shock absorber and a friction reducer. Inside your epiphysis is going to be where you'll find a lot of cancellous bone, spongy bone. That's where you're going to have a lot of red marrow filled. That red marrow's job is to actually produce red blood cells. So any sort of damage to there, not only do you need to worry about the epiphyseal plate, you also need to worry about your red blood cell count because you need that red marrow to constantly be regenerating red blood cells. And actually, somebody that gets a stem cell treatment, or if they need a blood infusion of some kind, they can actually steal red marrow out of your hip bones in order to pull some of that red marrow and grow red blood cells out of them in order to move them to wherever they may need. And again, my picture's in the way. But again, this is just the same picture as before. Your proximal epiphysis, distal epiphysis. This bone here is the humerus bone that we're looking at. But you can see that articular cartilage lining the outside of both of these epiphyses. That spongy bone filling the inside, and that normally would be filled with red marrow. So one final picture, that way you're just able to see these on a larger scale. This has everything that we talked about. You have your compact bone, your spongy bone on the inside here. Here, looking at a long bone, this is obviously a flat bone from your skull that the picture is showing. But you kind of, they have very similar structures when you look at things like you have the periosteum and you have the compact bone and you have the spongy bone in both. The main difference is going to be in your long bone. You're going to have this medullary cavity filled with yellow marrow, and you're going to have some sort of epiphyseal plate or epiphyseal line, because your limbs need to grow a lot more than your skull does. So that is the anatomy of a long bone. It kind of gets tough to kind of wade through some of the things, remembering what is where. So make sure you're using that updates tab, asking questions in class, whatever you need to do to be able to keep everything straight.